Hey everyone, and welcome back for another deep dive.
It's great to be here.
Today we're going to be putting on our thinking caps
Yeah,
and really getting into some serious medical detective work.
absolutely.
We're talking acid-base disorders.
Yeah, these are so important for any healthcare professional to get.
Oh, absolutely.
Mm-hmm.
They can really throw a wrench in things if you're not careful.
For sure. And we've got two
Yeah.
really fascinating case studies that we're going to dig into a little bit later.
Ooh, I love a good case study.
Me too.
Yeah.
Really brings everything to life.
Yeah, makes it real.
And, it helps you think on your feet.
Exactly. So you're not just memorizing terms.
Yeah.
You're actually like, oh, I can see how this would play out in the real world.
Absolutely. And I think that's key for really mastering this topic.
Okay, so
Yeah.
before we get ahead of ourselves,
Mm-hmm.
let's start with the basics.
Okay.
Acid-base balance.
Yeah.
What does that even mean?
So think of it like a seesaw,
Okay,
with acidity on one side and
Yeah.
alkalinity on the other.
I like this visual.
Our bodies.
Yeah.
We're always trying to keep those two in perfect harmony.
It's like a constant balancing act.
It really is. And
Yeah.
we measure this balance using something called pH,
Right,
which is essentially a scale.
like a thermometer.
Exactly. A thermometer for acidity and alkalinity.
Okay, so that sweet spot for pH in our blood is between 7.35 and 7.45.
That's right.
But what happens when things get out of whack?
That's when we run into problems.
Trouble.
Yeah, if the pH dips below 7.35, that's what we call acidosis.
Acidosis.
And it can lead to all sorts of issues, fatigue, confusion,
Wow.
even coma in severe cases.
That's scary.
On the other hand, if the pH goes above 7.45,
Okay.
that's alkalosis,
Alkalosis.
which can cause muscle twitching spasms, even seizures.
So yeah, maintaining that balance is super important.
Absolutely vital.
But what throws it off in the first place?
Right, what causes these disorders?
Yeah, like what are the culprits here?
So we can group them into four main types.
Okay.
The first two involve our respiratory system.
Okay, breathing.
Exactly. Respiratory acidosis is when we have too much CO2 in the blood.
Too much CO2.
Yeah, think of someone with COPD who's struggling to breathe.
Struggling to breathe.
Or even someone holding their breath for a really long time.
Like a kid in a swimming pool?
Exactly.
Yeah.
Their body can't get rid of that CO2 fast enough.
Makes sense. So then respiratory alkalosis would be the opposite.
You got it. Not enough CO2.
Yeah, not enough CO2.
Think of someone who's hyperventilating during a panic attack.
Oh yeah, they're breathing so
They're
fast.
blowing off way too much CO2.
And that throws off the balance.
Exactly. Now, the metabolic disorders, those can be a little trickier.
Yeah, those always seemed a bit more mysterious to me.
Right. They're a bit more behind the scenes.
Behind the scenes.
So metabolic acidosis can happen for a bunch of reasons.
Okay.
Kidney failure is a big one because the kidneys help filter out acids.
Right, the kidneys are like the cleaning crew.
Exactly. And then there's diabetic ketoacidosis,
Diabetic ketoacidosis.
where the body starts producing excess acid as it breaks down fat for fuel.
Oh wow, so it's like the body's own metabolism is working against it.
In a way, yeah. And then on the other side, we have metabolic alkalosis.
Metabolic alkalosis, what causes that?
Well, things like severe vomiting, where you're losing stomach acid.
Losing stomach acid.
Or even overusing antacids.
Antacid.
Which can neutralize too much acid and push things towards alkalinity.
So it's all about balance even with medications.
Exactly. Moderation is key.
Okay, I'm starting to get a feel for these different disorders.
Yeah.
But you mentioned mixed disorders earlier.
Right.
Those sound extra challenging.
They can be.
What happens when someone has more than one of these imbalances going on at the same time?
It's like a double whammy.
Oh no.
Yeah, so imagine someone with COPD
Okay.
who also develops diabetic ketoacidosis.
Whoa.
They'd have both respiratory and metabolic acidosis happening at once.
That sounds really tough for the body to handle.
It is, and that's why diagnosing these mixed disorders can be so tricky.
Yeah, you really have to be a detective.
Yeah.
So how do we even begin to unravel these cases?
Well, one of the most important tools is the arterial blood gas analysis.
Ah, the ABGs.
Yeah, or ABGs for short.
Those can feel like a puzzle in themselves sometimes.
They can be, but they give us crucial information.
Okay, so what do they tell us?
They give us three key pieces of data.
Right.
First, we get the pH,
Okay.
which tells us if the patient is in acidosis or alkalosis overall.
So that's our starting point.
Exactly. Then we have the PaSO2,
PaSO2,
which measures carbon dioxide in the blood.
carbon dioxide.
This helps us see if there's a respiratory component to the imbalance.
So that's our respiratory clue.
Right. And lastly, we look at bicarbonate, or HCO3.
Bicarbonate.
This tells us how the kidneys are compensating.
The kidneys.
Yeah, and whether there's an excess or deficiency of bicarbonate in the system.
Okay, so By piecing together these three values, we can start to figure out what's going on.
Exactly. Even in those complex mixed disorders.
That's amazing.
It's putting together a puzzle.
I like that analogy.
And there's another tool that's super helpful in these situations, the anion gap calculation.
Wait, hold on. Before we get into that,
Sure.
I think it'll be really helpful to see how these concepts play out in a real-life scenario.
I agree.
What do you say we dive into those case studies you mentioned?
Absolutely. I think they'll really bring these ideas to life.
Perfect. Let's hear about the first case.
Okay. All right. So our first case is a 68-year-old male with a history of COPD.
COPD. Okay.
Comes into the hospital
Right.
with worsening shortness of breath,
Makes sense.
and his blood sugar is way high.
Oh, no.
Turns out he's also in diabetic ketoacidosis.
So we've got like a double whammy here, right?
Yeah.
Potential for both respiratory and metabolic acidosis.
Exactly. And, like we were talking about earlier, that can be a pretty serious situation.
Absolutely. So what does ABGs look like?
Well, his pH is 7.25.
Low.
His PeCO2 is 60 millimole Hg.
Why?
And his bicarbonate is 14 millieql.
Low. So definitely not looking good.
No, not at all.
Let's break this down a bit more. Okay. The low pH obviously confirms acidosis.
Right.
The high PeCO2 that's pointing to respiratory acidosis from the COPD.
Makes sense.
And that low bicarb, that's our metabolic acidosis from the diabetic ketoacidosis.
Yeah, you got it.
His body is having a rough time.
Yeah, it's fighting a tough battle.
And this is where understanding compensation is so important, right?
Absolutely.
Because in a simple case of respiratory acidosis, the kidneys would try to compensate.
Right, they'd retain bicarb to buffer that extra acid.
But here, his kidneys are already overloaded.
Exactly. They're dealing with that metabolic acidosis already.
Right, so they can't really do their job properly.
And that makes the situation much more difficult to manage.
It's like his body's being pulled in two different directions.
A real tug-of-war.
Okay, let's switch gears and talk about case study number 2.
Okay, so this time we have a 24-year-old female.
Much younger.
Yeah, she presents to the ER
Okay.
with severe anxiety.
Anxiety, okay.
And she's breathing super rapidly.
Oh, so we could be thinking respiratory alkalosis?
Potentially.
She also mentions having diarrhea for the past few days.
Yes, persistent diarrhea.
So that could be metabolic acidosis.
Right, so we might have another mixed disorder here.
It seems like those are more common than we might think.
They can be.
So what were her ABGs?
Her pH was 7.38.
Normal.
PeO2 was 25 millimole Hg.
Low.
And her bicarbonate was 18 millimole HgL.
Also low. This is interesting.
Yeah.
Her pH is normal, but the other values are out of whack.
Right. It's a bit of a paradox at first glance.
How is that even possible?
Well, it's a perfect illustration of how the body tries to maintain balance.
Even when things are chaotic.
Exactly. So in this case, her respiratory alkalosis from the anxiety and rapid breathing,
Okay.
that's actually compensating for the metabolic acidosis caused by the diarrhea.
So one imbalance is canceling out the other.
In a way, yeah, her body's pretty amazing.
That's wild. So the ABGs alone don't tell the whole story.
Not always.
We really need the whole picture.
Right. The patient's history, their symptoms, the whole context is crucial.
It's like detective work.
It is. You have to piece together all the clues.
This really highlights how important it is to treat the patient, not just the numbers.
Absolutely, 100%.
Okay, so how does the body actually do this balancing act?
So there are two main ways the body tries to restore that acid-base balance.
Okay, 2 main ways.
First, we've got the respiratory system.
Breathing.
Right. The lungs can adjust how fast and how deep you breathe
Okay.
to either keep or get rid of CO2.
So the lungs are like the first line of defense.
Yeah, they respond pretty quickly within minutes.
Quick action.
But sometimes that's not enough.
Okay.
Or the problem is metabolic in the first place.
Right.
That's when the kidneys step in.
The kidneys are back.
They're the heavy lifters.
Okay.
They work more slowly,
All right.
but they can really fine-tune those bicarbonate levels.
So it's a slower process, but more precise.
Exactly. And this metabolic compensation can take hours or even days to really kick in.
It's amazing how the body has these different systems working together to keep everything in balance.
It's a beautifully orchestrated system.
You mentioned earlier that the anion gap calculation can be helpful in diagnosing mixed disorders.
Yeah.
Can you talk a little bit more about that?
Sure. So the anion gap basically helps us figure out what's causing metabolic acidosis.
Metabolic acidosis. Okay.
It's calculated using electrolytes like sodium chloride and bicarb.
Okay.
And it tells us if there's something funky going on with the unmeasured anions in the blood.
Funky, how so?
Like an unusual increase.
Okay.
Which can be a clue to the underlying cause.
So why is that so important?
Well, let's say we have a patient with metabolic acidosis.
Okay.
By calculating the anion gap, we can tell if it's due to lactic acid buildup ketoacidosis or something else entirely.
So it helps us narrow things down.
Exactly. It's like a magnifying glass for metabolic acidosis.
I like that it helps us see those tiny details.
It's all about connecting the dots, using all the information we have.
I'm really starting to appreciate the complexity of all of this.
It is complex.
But also how much we can learn.
Oh, yeah. There's always something new to discover.
So much to learn.
Definitely.
This has been super insightful.
Glad to hear it.
But I'm curious, for our listeners out there,
Yeah.
whether they're seasoned healthcare pros or just starting out, what would you say is the biggest takeaway from all this?
I think the biggest takeaway is that, acid-base balance isn't just some theoretical concept.
Yeah.
It's really vital for taking care of patients.
Right. It has real-world implications.
Absolutely. And understanding these disorders can completely change how we approach diagnosis and treatment.
It's like having a secret code book for the body.
Exactly. It helps us decipher what's really going on.
Yeah. But it's not enough to just memorize the facts.
No.
We have to see the bigger picture, right?
Right.
Connect those lab values with what the patient is actually experiencing.
Exactly.
Yeah.
To put all the pieces together.
Like a medical detective.
That's the idea.
Speaking of tricky cases, I want to leave our listeners with something to think about.
Okay.
Imagine you're a doctor.
All right.
And you get a patient's chart
Yeah.
with some crazy ABG results.
Oh, boy.
Where would you even begin?
Well, first I'd take a deep breath
Good idea.
and remind myself to take it one step at a time.
Don't panic.
Exactly.
Yeah.
No jumping to conclusions.
Okay, so start with the basics.
Yeah, gather all the information.
The patient's history, their symptoms,
Medications they're on.
and of course those ABGs.
All the clues we can get.
It's like building a case file.
Exactly. Then I'd look at the pH.
Okay,
Is it acidosis or alkalosis?
that's our starting point.
Then the PaCO2 and bicarbonate
Okay.
to figure out if the main problem is respiratory or metabolic.
All right, so we're narrowing it down.
And don't forget those compensatory mechanisms.
Right. It's the body trying to fix things.
Are the lungs and kidneys working together, or are they part of the problem?
So many things to consider.
And if it's still not clear, that's when we can use the anion gap.
Right. To help us with those tricky metabolic acidosis cases.
It's all about connecting the dots and thinking critically.
I love how you put that. It's really a process of elimination sometimes.
Often it is.
Well, this has been an amazing deep dive
It has.
into the world of acid-base disorders.
We've covered a lot of ground.
We really have, from the fundamentals to those really complex situations.
I hope it's been helpful for everyone.
Absolutely. We talked about interpreting ABGs, understanding how the body compensates, and even using that anion gap to help us make decisions.
It's all connected.
It really is. I have to say, I'm walking away with a whole new level of respect
Yeah.
for how incredible the human body is.
That's remarkable how it all works together.
So intricate and resilient.
Truly amazing.
And even though we've learned so much today, there's always more to explore, right?
Oh, definitely. This is just the tip of the iceberg.
So to our listeners out there, keep those brains working.
Yeah.
Keep asking questions.
Never stop learning.
And never stop diving deeper into the fascinating world of medicine.
It's an incredible journey.
It really is. Thanks for joining us on the Deep Dive.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.